Now, let's talk about some of the effects and risks of cannabis use. The short-term effects of cannabis use can vary depending on the individual, the dose, and the method of consumption. But common short-term effects of cannabis use typically include euphoria. A lot of users experience this sense of heightened mood and relaxation and a general feeling of well-being. Cannabis can also distort sensory perception, leading to changes in how users perceive colors and sounds, and also how they perceive time. Cannabis use also causes a temporary increase in their heart rate, known as tachycardia. And one of the most noticeable side effects, physical side effects, is red or bloodshot eyes due to the expansion of blood vessels. Users get dry mouth, which is often referred to as cotton mouth. It leads to reduced saliva production, resulting in the dry mouth. And a lot of users experience an increased appetite, which is commonly referred to as the munchies, because it affects the metabolic system. And it impairs motor skills, coordination, and it leads to difficulties in tasks that require precision. Also, cannabis use leads to increased creativity and different thought patterns. And some users report a heightened sensory experience like enhanced taste or enhanced touch. Cannabis use also impacts short-term memory, making it very challenging to remember recent events or tasks. And users may experience a sense of relaxation and stress relief. And some users report heightened sensory experiences like enhanced taste or touch. And in some cases, particularly high doses or in individuals who are predisposed to anxiety, cannabis leads to feelings of anxiety or paranoia. So it's important to note that individual reactions to cannabis vary, and the effects can be influenced by factors like the strain of the cannabis or the method of consumption, whether it was smoking, vaping, edibles, what have you, and also the user's tolerance and prior experience with the drug. Additionally, the short-term effects of cannabis are not always positive. There can be risks associated with use, particularly when used inappropriately or in excess. There's an increased risk of accidents. The risk of accidents after consuming marijuana is of significant concern, particularly when they operate vehicles or heavy machinery under the influence of the drug. Marijuana does impair cognitive and motor functions, and it increases the likelihood of accidents. And the degree of impairment can vary based on factors like the content of THC of the cannabis and the individual's tolerance and the method of consumption. So some of the key points regarding the risk of accidents associated with marijuana use are impaired motor skills, coordination and reaction time, which are essential for tasks like driving or operating machinery or even when walking safely. And then when driving under the influence, when driving while impaired by marijuana, significantly is going to increase the risk of accidents. There's been studies that have shown that THC, the psychoactive compound in marijuana, can affect the driver's ability to make decisions and respond to unexpected situations on the road. There's also an increased risk of collisions. Research has indicated that people who drive under the influence of marijuana are at higher risk of being involved in traffic accidents. And this risk is especially pronounced when marijuana is combined with alcohol. There's delayed reaction times, making it difficult for drivers to respond quickly to road hazards or changes in traffic or unexpected events. And it also distorts sensory perception, so it can lead to impaired judgment about distance, speeds, and the severity of road conditions. In addition to driving, operating heavy machinery or performing other complex tasks while under the influence of marijuana can also increase the risk of accidents, as precision and focus are crucial in these situations. And the combined use of marijuana with other substances like alcohol or prescription medications can amplify the risks of accidents, as the effects of these substances may interact in unpredictable ways. So to mitigate the risk of accidents related to marijuana use, it's important to avoid operating any form of machinery, including vehicles, while under the influence of the drug. Responsible use and understanding the potential impairing effects of marijuana are essential to ensure the safety of yourself and other people. And then laws and regulations regarding marijuana use and driving are going to vary by jurisdiction, so it's just really crucial to be aware of the legal standards in your area. In many places, driving under the influence of marijuana is illegal and subject to penalties. There's also the increased risk of psychosis. So consuming high levels of THC is associated with an increased risk of psychosis. Psychosis is a mental health condition that's characterized by a disconnect from reality, and that manifests as hallucinations or delusions or impaired thinking. And while not everybody who uses high THC cannabis is going to experience psychosis, research does suggest that the risk is higher, especially in those who are predisposed to mental health issues or who have a family history of psychiatric disorders. High THC cannabis strains can exacerbate symptoms in individuals with conditions like schizophrenia, and it may trigger a first episode of psychosis in vulnerable individuals. So you get an earlier onset. And it's essential to be aware of the potential risk for high THC cannabis use, especially for those with a history of mental health conditions, and to exercise caution when using products with elevated THC levels. Our bodies are not designed to have that much THC, and the new breeds and things of that nature have higher THC levels, and because our body's not designed to handle that, it can essentially break us and cause us to have what we would refer to as a THC overdose, and that leads to the psychosis. Other individuals can develop cannabis hyperemesis syndrome, which I didn't list on here, but hyperemesis is vomiting, and so people with cannabis hyperemesis syndrome may vomit after smoking. The potential long-term effects of cannabis use are going to vary from person to person, and again, they're influenced by factors like the frequency and the quantity of use, and also the age at which the use began, and the individual's susceptibility to things. So some of the common ones are cognitive impairment. Chronic cannabis use, especially when initiated at a young age, can lead to cognitive deficits, and that can include impairments in memory, attention, and also in learning. Some studies suggest that heavy cannabis use in adolescence is associated with a decreased likelihood of completing higher education. And long-term cannabis use can lead to a lack of motivation, which we call amotivational syndrome. And this can impact a person's ability to set and achieve goals. Smoking cannabis, like smoking tobacco, can lead to respiratory problems like chronic bronchitis and lung irritation, and the risk is especially high for frequent and heavy smokers. And prolonged use can lead to the development of cannabis use disorder, which includes symptoms like tolerance, withdrawal, and unsuccessful efforts to quit. Dependence on cannabis can have various negative consequences in the person's life. Also, long-term cannabis use has been associated with an increased risk of mental health problems like anxiety disorders, depression, and an elevated risk of psychotic disorders like schizophrenia in vulnerable people. And chronic cannabis use can lead to difficulties in relationship, work, and just an overall social functioning. It can hinder personal and professional growth. And the long-term use of cannabis can result in persistent impairments in motor skills and judgment, which can be particularly problematic when driving or operating heavy machinery. And in regions where cannabis is illegal, long-term use can lead to legal issues, including arrests and criminal records. And it can also result in social stigmatization. So it's important to note that the long-term effects of cannabis can vary based on the specific strain and the potency of the cannabis used. Some people may use cannabis without experiencing significant negative long-term effects, while others can be more susceptible to the adverse consequences. Responsible and informed use, as well as understanding individual risks, is going to be essential for mitigating potential long-term effects that are associated with the cannabis use. So, if someone has a concern about cannabis use or the effects, they should seek guidance from a healthcare professional. The potential risk for developing schizophrenia with cannabis use has been subject of scientific study and debate, and while not everybody who abuses cannabis is going to develop schizophrenia, there is evidence to suggest that cannabis abuse, especially in individuals with certain predispositions, can increase the risk of developing this serious mental health disorder. So when I'm talking about predisposition, genetic and environmental factors play a significant role in the development of schizophrenia. Some people have a genetic predisposition to the disorder, and exposure to certain environmental factors, including cannabis abuse, can trigger its onset. And there's evidence to suggest that the risk is greater when cannabis use begins in adolescence or early adulthood. The number is 14 to age 25. So the developing brain is particularly vulnerable to the effects of cannabis during that period. Frequent and heavy cannabis use has been associated with a higher risk of developing schizophrenia, and higher doses and more potent cannabis strains with elevated THC levels actually increase this risk. And some people may experience acute psychotic symptoms like hallucinations and delusions either during or shortly after the cannabis use, and this is often referred to as cannabis-induced psychosis. These episodes can be a precursor to or a sign of increased vulnerability to schizophrenia. The longer that the person abuses cannabis, the greater the potential risk. Long-term chronic use is associated with that higher risk of mental health issues, including the schizophrenia. So that risk of developing schizophrenia is going to be influenced by that complex interplay of factors, including the genetics, family history, other substance use, and the presence of stressors or traumas in that person's life. So it's essential for me to emphasize here that while there is evidence suggesting the link between cannabis abuse and the risk of developing schizophrenia, that association is not absolute. A lot of individuals use cannabis without developing schizophrenia. However, for those with a family history of schizophrenia or other risk factors, it may be wise to exercise caution and consider either avoiding or limiting the cannabis use. If you have concerns, maybe that person can seek more guidance from a healthcare professional. And also, it's crucial for people to be aware of the legal status of cannabis in the region that you live in and its use for whatever legal implications. So cannabis dependency, which we call cannabis use disorder or CUD, refers to a problematic pattern of cannabis use that's characterized by a person's inability to control their consumption and increased tolerance and withdrawal symptoms when use is reduced or stopped. It can lead to negative consequences in various aspects of someone's life, like their relationships, work, and just overall well-being. And cannabis addiction is a subset of dependency. It involves not only the physical and the psychological reliance on the drug, but also compulsive, often uncontrollable drug-seeking behavior despite the adverse outcomes. And both dependency and addiction are associated with a range of physical, psychological, and social consequences, and they may require professional treatment and intervention for recovery. The development of cannabis dependence, also known as cannabis use disorder or CUD, can be influenced by a combination of genetic or environmental or personal factors. Some of these risk factors with the development of cannabis dependence include the genetics, which play a significant role in the risk of developing the dependence on cannabis. So people with a family history of substance use disorders can be more vulnerable. Also, the earlier age of onset, initiating cannabis use at a young age, particularly during adolescence, is a significant risk factor. The developing brain is more susceptible to the effects of cannabis during this period. The frequency of use, frequent and heavy cannabis use is going to increase the risk of dependence, and regular use leads to tolerance, and that's where larger amounts are needed to achieve the desired effects. So where, a couple hits used to get them high, now it takes the whole blunt. And then cannabis strains with higher levels of THC, which is that psychoactive compound, can be more reinforcing and therefore increase the risk of dependence. And individuals with pre-existing mental health conditions such as anxiety or depression or post-traumatic stress disorder might be more likely to develop cannabis dependence as a form of self-medication. A person's social environment or peer group can influence cannabis use. Being in social circles where cannabis use is common may increase the risk. And insufficient family support or a lack of access to mental health resources can also contribute to an increased risk of developing dependence. And certain personality traits like impulsivity or sensation seeking or a propensity for risk-taking behavior can heighten the likelihood of cannabis dependence. High levels of stress or trauma or significant life events can lead to some individuals turning to cannabis as a coping mechanism, increasing the risk of dependence. A history of alcohol or other substance use actually increases the likelihood of developing dependence on cannabis. So it's important to recognize that not everybody with these risk factors will develop cannabis dependence, and the interplay of these factors can vary from person to person. But prevention and intervention strategies like education and counseling and support can help mitigate these risks and address cannabis use issues when they arise. So withdrawal symptoms that are associated with cannabis use are typically mild compared to those of some other substances, but they can still contribute to addiction in several ways. A lot of people seem to believe that cannabis doesn't have any withdrawal symptoms, and that's just not true. They liken it to withdrawal of opioids, and it's just not the same. I liken it to withdrawal of tobacco or nicotine. So the withdrawal symptoms vary in intensity and duration from person to person, but the common symptoms are irritability. People become easily agitated, irritable, and quick to anger during withdrawal. There's an anxiety, increased nervousness. That's common withdrawal symptoms, which can be uncomfortable for the people that are experiencing them. A lot of people going through cannabis withdrawal report difficulty falling asleep or staying asleep. And some people experience a decreased appetite, which leads to weight loss and nutritional deficits. And also intense cravings for cannabis can be prominent during the withdrawal period, and that creates this risk of relapse. There's also mood swings, which include sadness or depression that happen during withdrawal. Feelings of restlessness and discomfort can be experienced, making it very challenging to relax. And some people report physical symptoms like headaches or chills and stomach discomfort during withdrawal. And the contribution of these withdrawal symptoms to addiction lies in their role in the cycle of drug use. When people experience these uncomfortable symptoms during withdrawal, they may be driven to use cannabis again to alleviate the discomfort. And this cycle of relief through drug use is followed by withdrawal symptoms, and that can reinforce a person's dependence on the drug and make it more challenging to quit. Also, the experience of withdrawal symptoms can lead to a psychological dependence on cannabis because people come to rely on the drug to manage their emotional and their physical states, and this creates this sense of perceived need for cannabis to function normally, leading to the continued use and ultimately leading to addiction. So it's important to note that not everybody's going to develop cannabis dependence or addiction, and the severity of the withdrawal symptoms can vary widely, but nevertheless, the potential for withdrawal symptoms is one of the factors that make it difficult for people to quit using it, and reinforcing the need for professional help and support in addressing cannabis use disorders. So cannabis use has a complex relationship with mental health, and the impact varies depending on individual factors or the frequency of use and the age at which the use began. There's an increased risk for anxiety disorders. Cannabis use, particularly at higher doses, leads to acute symptoms of anxiety and panic attacks. In some people, cannabis use exacerbates pre-existing anxiety disorders, but the relationship is multifaceted, and some people use cannabis to self-medicate anxiety symptoms, which leads to a cycle of use. Chronic cannabis use, especially in high quantities, has been associated with an increased risk of depression, The relationship between cannabis and depression is complex, and it may involve factors like genetics and individual susceptibility. Cannabis use, particularly heavy and prolonged use, is associated with an elevated risk of psychosis, with symptoms like hallucinations and delusions. And for people with a predisposition to schizophrenia and other psychotic disorders, the use acts as a trigger or an exacerbating factor. So the relationship between cannabis and psychosis is an active area of research, and not all users are going to develop those psychotic symptoms. And we know that the adolescent brain is still developing, and cannabis use during that period can have significant consequences. Research is suggesting that early and heavy cannabis use during adolescence impairs cognitive functioning, including memory, attention, and learning. And it also increases the risk of developing mental health issues later on in life, including anxiety, depression, and psychotic disorders. So it's important to know here that while cannabis use may be associated with the mental health risks, not everybody who uses cannabis is going to experience the adverse effects. Like I said before, genetics and frequency of use and the quantity and the underlying mental health of the person is going to play that determining role in the impact of the cannabis use on mental health. So preventing or addressing these potential risks involves making informed decisions about cannabis use, especially among young individuals, and getting them professional help when it's needed. It's also important to consider the legal status of cannabis in the region and the potential consequences of use, especially in places where it is illegal. And if you have a concern about the impact of cannabis on your own mental health, it's advisable to consult with a healthcare provider or mental health professional. I'm going to discuss the potential benefits later on in another lesson, but there are potential medical benefits for people with cancer and MS and epilepsy and for pain or nausea management, but it's important to note that the use of cannabis for medicinal purposes should always be done under medical supervision. And as an addiction counselor, it's crucial to have a thorough understanding of the local laws and regulations regarding cannabis for a couple of reasons. Firstly, staying informed about the legal status of cannabis in your region is going to allow you to provide accurate and up-to-date information to your clients. And this knowledge is essential in helping people make informed decisions about their cannabis use and better understand the potential legal consequences of their actions. And secondly, local laws and regulations can significantly impact the treatment and support options that are available to people who are struggling with cannabis addiction. And understanding these laws allows you to guide your clients through appropriate resources and interventions, whether it be through government-funded programs, community services, or private treatment facilities. And then furthermore, being aware of the legal landscape is going to help you to address any legal challenges your clients might face due to their cannabis use, including the potential legal consequences like arrest or court-mandated treatments. And so by incorporating this legal knowledge into your counseling approach, you can better assist your clients in navigating their addiction and achieving successful recovery while remaining in compliance with the local laws. Overall, understanding local cannabis laws and regulations is an integral part of providing comprehensive and effective addiction counseling services. So let's talk about harm reduction and responsible use. Responsible cannabis use is essential to minimize the potential risks and negative consequences that are associated with its consumption. So setting personal limits is a fundamental aspect of responsible use. People should establish clear boundaries regarding the quantity and the frequency of their intake, and taking into account their own tolerance and preferences and reasons for use. Avoiding driving or operating heavy machinery under the influence of cannabis is not only a legal requirement in a lot of places, but also a crucial safety measure. Cannabis impairs motor skills and judgment, and it increases the risk of accidents. And responsible users understand the importance of staying sober while driving to protect themselves and others. Also, seeking help when it's needed is a hallmark of responsible use. If somebody starts to experience negative consequences or find it challenging to control their consumption of cannabis, reach out to a healthcare professional or an addiction counselor. That's the proactive step. And addiction counselors can provide guidance, support, and resources to address the problematic patterns of use and prevent dependence or addiction. Responsible cannabis use is about self-awareness and self-regulation and taking measures to ensure that the benefits of cannabis are maximized while minimizing potential harm. I had somebody tell me one time, roll your own weed. Don't just smoke anything that somebody hands you because you don't know what they're putting in it. That's another harm reduction technique. Make sure you know what you're getting. There are treatment options available for cannabis dependence and addiction, and these are essential to help people break that cycle of problematic use and regain control over their lives. One effective approach is behavioral therapy, like cognitive behavioral therapy or CBT. CBT helps people identify and modify the thought patterns and the behaviors that contribute to their dependence. Motivational enhancement therapy, or MET, is another beneficial therapy that focuses on increasing the person's intrinsic motivation to change. Group therapy can provide a support and non-judgmental environment where people can share their experiences and strategies for recovery. Also, family therapy can be valuable to address family dynamics and support systems that play a role in dependence. For people with severe cannabis use disorders or co-occurring mental health issues, residential or inpatient treatment programs may be necessary. And these programs offer structured environments, intensive therapy, and medical supervision. And medications, while these are not the primary treatment for cannabis use disorder, they can be used to manage specific symptoms like anxiety or sleep disturbances during withdrawal periods. Ultimately, the choice of treatment should be tailored to the individual's unique needs and circumstances. So seeking help from an addiction counselor or healthcare provider is a crucial first step in identifying the most appropriate treatment plan for each person struggling with cannabis dependence or addiction. There are several support resources or organizations that provide assistance to people struggling with cannabis addiction or dependence. There's national helpline services. A lot of countries have national helplines or hotlines that offer free, confidential assistance and referrals to treatment or support services. So, for example, in the United States, the Substance Abuse and Mental Health Services Administration, or SAMHSA, provides a national helpline at 1-800-662-HELP, or that's 4357. Local addiction treatment centers or outpatient programs offer specialized services for cannabis addiction, and they may provide therapy or counseling or support tailored to the individual's needs. There's also organizations like the National Alliance on Mental Illness, which is NAMI, and the Mental Health America, or MHA, which can provide resources and support for people dealing with co-occurring mental health conditions and substance use disorders. There's self-help groups like Marijuana Anonymous that offers a structured environment for people seeking to recover from cannabis addiction through mutual support and shared experiences. And then there's online platforms and forums that can be valuable sources of support for people who prefer to connect with others facing similar challenges. There's several on Facebook. Licensed addiction counselors and therapists who specialize in substance use disorders can provide individualized treatment and support. Loved ones can be a valuable source of support and encouragement during the recovery process. Local health departments or community organizations might offer addiction services, including counseling and treatment referrals. And there's various mobile apps that are designed to support people in their recovery journey, and they offer tools and resources and support. So it's important to seek help from professionals and organizations with experience in addiction treatment, because they're going to provide guidance on the most appropriate resources and treatment options based on the person's specific needs. And individuals should consult healthcare providers for a comprehensive assessment and a personalized treatment recommendation. So in summary, cannabis has short and long-term effects, and risk can lead to dependency and withdrawal with cessation. There are some benefits, but we must always take into consideration the laws and the regulations, and we should strive for abstinence or harm reduction in treatment. If you have any questions, feel free to post them in the comments box below the video. And if you have any other concerns, feel free to reach out to me. My email and phone number are listed here.